So my friend, this is the second part of the therapeutics related to child. Now we stopped at ammonium car. Next drug, a very important drug, you must have used lot in your practice, that is Antim crud. What is Antim crud? Child is fretful, child is peevish, cannot bear to be touched or looked at. A very important symptom, cannot bear to be touched and looked at. Now when reading Materia Medica or when giving exams, this symptom will mug up and write and we get good marks. But what is the meaning of this? The child does not like to be looked or touched. He is so irritable. If you ask, हाँ क्या तकलीफ है? कुछ नहीं, मुझसे मत पूछो. हाँ आप स्कूल जाएंगे? हाँ मैं देखूँगा कल. खाना खाएंगे? नहीं. आलू खाएंगे? नहीं आलू नहीं पसंद मुझे. अरे कल तो बोलता आपको आलू खाना है, नहीं मुझे नहीं खाना. कुछ भी पेशेंट को बोलो, whatever you tell the patient, the child does not wants to be touched and looked at. This is important. So important, 3 marking symptom, but if you fail to interpret in your patients, you will never be able to see the beauty of Antim crud prescription. Don't always think about peevishness and fretfulness like abrotanum I told you, but cannot bear to be touched and looked at. This is important. अभी किसी मम्मी बच्चे का बाल ठीक कर रही, अरे मत करो, अच्छा खराब मत करो. If the child wants to have a bath, ऐसे तो अपन नहा लेते हैं, नहीं मुझे नहीं नहाना है, मैं अपना नहा लूंगा. Does not want to be touched and looked at. This is how you should interpret the symptoms. That is important in Antim crud. Sulky, you can say, sulky, does not wish to speak or be spoken to. और be spoken to. sulky, हमें जब रोता ही रहता, बोलते ना रोतरू चाइल्ड, रोतरू एक नंबर के, रोते ही रहता है, कुछ भी करो रो जाए, कुछ भी करो रोता रहता है. ये पूछो ये पूछो नहीं, वो करो नहीं, बात करो नहीं, खाना है नहीं, रोतरू चाइल्ड. See beautiful symptoms written. Sulky, does not wish to speak or be spoken to. Angry at every little attention. थोड़ा भी उसको अटेंशन दो, उसके भले के लिए, फिर भी गुस्सा. Angry at every little attention, and then becomes Antim crud, a very crude drug. Cruel, not like abrotanum, maybe a degree, but every time sulky. You must remember few drugs because for this: Antim crud, Antim tart, iodum, and silicium. ये भी ऐसे ही है. Sulky children does not wish to be spoken to or to speak to. Sulky children. Remember Antim crud, remember Antim tart, remember silicium, remember iodum also. Children cannot bear to be washed or bathed with cold water. अगर बच्चे को नहाना पसंद नहीं है, बोल दिया, the next symptom is ask the parents is नहाना क्यों पसंद नहीं है. बोले डॉक्टर साहब नहीं नहाना, उसको गरम पानी दो ना, उसको नहाना बहुत पसंद है, ठंडे पानी से नहीं आता. बट आप देखो नागपुर में अपना कितना चल रहा है, 46 डिग्री चल रहा है अभी अपना, फिर भी बोलता है मैं गर्म पानी से नहाना है. नॉट बिकॉज अ चाइल्ड इज डज नॉट लाइक वॉशिंग, बट डज नॉट लाइक टू बी वॉश्ड विथ cold water, and this is the most important symptom of Antim crud. So my dear friends, in Antim crud, if you go to see the Materia Medica, the symptoms are very beautifully written, but it requires your interpretation. The difference between a good prescriber and a very good prescriber is only one thing: he is able to interpret the symptoms in the language of Materia Medica or in the language of repertory. Hence, he becomes a better prescriber than you. So don't try to get lot of symptoms from your patient and then prescribe. If you get 3-4 good symptoms, try to interpret what the patient is trying to tell you. I always say to my students and in my seminars, the main thing is interpretation of symptoms, and that is the key for the prescription. Otherwise, Antim crud you'll never be able to prescribe, because symptoms are like does not wish to be spoken to, very sulky children, does not wish to be touched or looked at. This is Antim crud. Of course, if bathing symptoms come, does not like to be washed with especially cold water, then you can think of Antim crud. But sulky children, remember Antim crude, Antim tart, iodine solution. So in a nutshell, this is Antim crude. Next drug after Antim crude comes Antim tart. Now you must have always heard Antim tart about cough, rattling cough, death rattle cough. You can hear the death rattle, you can hear the gurgling in the chest. That is Antim crude, my friends. Sleepy children, Antim crude. But how is the child of Antim crude? The child clings to those around, clinging children's. Very important symptom of Antim tart. Clinging children, clings to those around, चिपक जाता है जाके उसको, wants to be carried, cries and wins if anyone touches him. अभी मैंने क्या बोला आपको? Does not want to be touched and looked at. Antim crude. Now what I am telling about Antim tart, just listen carefully. The child cries and wins if anyone touches it. Will not let you, क्या बोलना चाह रहा हूँ मैं, will not let you feel his pulse, will not let you to examine him, and then it becomes Antim tart, my friends. A very important symptom. आप बोले हाँ मुंह खोलो, नहीं, हाथ दिखाओ, टच नहीं करने देगा आपको, then it is Antim tart. I told you in Antim crude also, sulky children, I compared it with Antim tart. Again I am telling you, Antim tart. Child clings to those around, wants to be carried, cries if you touch him, will not allow you to feel his pulse. Such beautifully written in a Materia. Such beautiful provers must be there who has told this symptom very carefully. So, will not let you touch. You must always think about Antim crude. Again I am telling you, Antim crude and Senicula. Two remedies are also important in this symptom. So you see, Antim crude, Antim tart, so close drugs, minor difference to interpret these two drugs. Next drug, again a very rare drug, but have seen wonderful results in my practice, and that is Apis mellifica. If you had seen my video about Apis mellifica mind, you will always come to know what I am telling you now. Apis mellifica children's. Sudden shrills, piercing screams from children's. Scream, chillar jam jam se shrill, piercing scream, piercing screams from children. बच्चे बहुत चिल्लाते हैं, बहुत ड्रग्स में ऐसा है. But what is the meaning of piercing? मतलब कान में उसका आवाज चुभ जाती है. अरे मत चिल्ला. For example, अभी आप कभी when you go to your tuition class and if the nails are very big of your lecturers, and when they write on the board and when the nails touch and he takes the chalk from up to down and the voice comes of the nails, it pierces your ears. So piercing cries of children, this symptom of Apis mellifica is important. Piercing screams from children while waking or sleeping. This is important. उठने टाइम पे भी एपिस मेलिफिका चिल्लाएगा और सोने के टाइम पे भी चिल्लाएगा. This symptom is important. If you get this symptom, my friends, piercing screams, you must think about Apis mellifica. One more drug very close to Apis mellifica is Helleborus. In Helleborus also you have piercing screams of children while sleeping or while awake. Two drugs are important, Apis mellifica and Helleborus. I'll not tell you more symptoms of Apis mellifica. There are a lot of symptoms. You can read Materia Medica, but the three marking symptoms, the prescribing symptoms, you must remember. That's why I'm telling you the symptoms. That's what I want to tell you in this small videos. The three marking symptoms you should never miss. You should hear that piercing smile. If I get time in the future, I'll post some videos of children who have piercing screams, and you will understand what is the meaning of piercing cries. I'll tell you in practical, clinical piercing children. But let me finish this videos of child. So piercing screams of children is Apis mellifica. Next drug, a very important drug, very polychrous drug you must have seen in the practice, I am going to tell you is Arsenic album. Again, teething children are pale. Lot of drugs, because दांत किसको निकलेंगे? बच्चों को ही निकलने वाले हैं। तो टीथिंग चिल्ड्रंस तो बच्चों में रहने वाला है, बुढ़ापे में टीथ बोल नहीं वाले। सो टीथिंग चिल्ड्रंस आर पेल, वीक, fretful. Pale, this is important. Paleness of arsenic. Paleness of arsenic and teeth in children's pale, fretful and wants to be carried. Now you must have understood wants to be carried. There are many drugs, but what is the 3 marking symptom of being carried in arsenic is important. You must have read and you know also, that is wants to be carried rapidly. बहुत फास्ट चलने की हैबिट रहती है, एंड देन दैट बहुत फास्ट चलना पसंद है, बहुत फास्ट गोदी में लेना पसंद है, एंड दैट बिकम्स आर्सेनिक एल्बम चिल्ड्रंस ऑफ कोर्स। एंड देन डायरिया, वेरी ऑफेंसिव, इतना ऑफेंसिव कि आजू बाजू बोलते कितनी बार सारी लैक्टेंस, दैट इज ऑल्सो आर्सेनिक। ऑफेंसिव स्टूल्स इज ऑल्सो आर्सेनिक। वी आर ओनली कॉन्सेंट्रेटिंग ऑन चाइल्ड, that is arsenic album. So teeth in children's, paleness, weakness, fretful, and wants to be carried rapidly, diarrhea and very offensive stools. The offensiveness can be smelled by the attendants also, and in the room also it is so much offensive. In books what it is written, diarrhea, cadaverous odor of stools, and that is the 3 marking symptoms of arsenic. So in short, few drugs I have told you. In the third part of video I'll add few more drugs. Thank you.